so we're supposed to be talking about our readings that talked about additional skills and training as a midwife. So as I was reading through those, I was kind of like taking inventory in my brain, like what would I want to do, what would I not want to do, what will I have to do in some of the places that I am potentially going to work. One of the big things, obviously, is doing second assist. And I think I would like to do second assist, but again, depending where I end up getting my job, because of the very different places that I've applied, I may or may not get the option to do that. But I definitely am interested in doing second assist. I think it would be a good thing to learn, a good thing to have on my resume. Something too that I had thought about was circumcisions, because I know midwives can perform those after they've had some training. I'm not super interested in performing circumcision. I think it would be an interesting skill to learn, but I don't think that that is something that I would like to do personally. Ultrasound training. Recently, I actually looked into some ultrasound training just because I was curious what was out there. It's not required at any of the places that I applied to have that training as a midwife. Our ultrasound technicians are really wonderful. Obviously, you need to be able to interpret a ultrasound report, but we don't necessarily have to perform the actual ultrasound at any of the places I'm applying. But I did find this, it's a midwife-specific training, and so it's kind of unique in that this company would come to your facility or your office and train your group of midwives or whoever. It is geared towards midwives. It's midwifery training for ultrasounds, and they will come to your site and train on your equipment so you can learn how to use ultrasound. It's like a 2-day training, I think. I think the second day is a lot of hands-on. The first day is more like, lecture and that sort of thing. I'm not interested right now in getting that training or certification because I don't necessarily need it at the moment, but I am definitely interested in learning that down the road. Another thing is colposcopies. Yes, this is something very basic that I think that would be a disservice if I wasn't able to do it in the office, so I would like to learn that as well. As far as operative deliveries go, in clinical, I have had 1 vacuum delivery and 2 forceps deliveries, and they're a little bit intimidating, especially the forceps, because I feel like there's a lot of technique there. And getting used to that, especially if you don't use it very often. But I am interested in learning those because I feel like when you need those things, you need them right away. And so, you can always call your backup physician or whoever you need to call. But I just feel like if you could have this tool as a midwife, it would really make you a stronger midwife, and you could use it as soon as you need to, especially in those situations where you're having decelerations or baby needs to come out right away by operative delivery. So I am interested in learning that if I'm able to. And then something a little bit newer on the scene, I feel like, is the SANE training for women who have been sexually assaulted. And I have heard a lot about this at the hospital that I am doing my clinicals at. They actually have SANE nurses that are specifically trained and on call to come in for those purposes. And this is something that I also would be interested in learning down the road later on, maybe, because I think that this would just be a really great service to be able to provide to patients, because obviously we need more SANE trained professionals, and it's definitely something important in healthcare. Something else that I'm looking into is perinatal mood disorder training. I feel like this is, finally we're starting to know a lot more about perinatal mood disorders. It's not just postpartum depression. We're learning more, and I'm seeing more in clinical too, patients with postpartum anxiety and pervasive thoughts and OCD type symptoms and things that are not postpartum depression. And so I just feel like I'm seeing a lot of that. I'm learning more about it, and I just realized there's so much more that we could be doing in that department. So I am actually looking at taking a certification course that would be in April. I'm hoping it's going to work out okay with school. If not, I'm just going to take it later on down the road. But I do definitely want to dive into perinatal mood disorders and really get that certification and get that under my belt, even though that's a little bit different than the normal add-ons for midwifery. I'm interested in that. In regards to that, my preceptor actually, she's going to get the training too. She's the one who told me about it. She said that there's this hotline number that she uses that you can actually call. It's like a panel of physicians or something like that, or a panel of some sort of professionals. But you can call and talk to them and find out, just to discuss your patient with them and figure out the best plan of care for them, and especially they help you pick out medications that would be most appropriate for your patient for whatever they're experiencing. So that's kind of cool. And then as far as going on to do more formal education, I know it talked a little bit about that in what we read. I am very uninterested in any form of education right now. I just feel so burnt out with school and learning, and I'm just ready to have a break from that. I will not say never, but I certainly am saying not right now. I don't want to do any more formal education and furthering my degree at this time, but perhaps in the future. But I think that all of these things, all of these add-ons, for lack of a better word, in midwifery are great. They make us more marketable. They definitely enhance the profession as a whole, and I think that they look great on resumes and really make you more of a hot commodity when you're applying for jobs. So I'm hoping to add on as many things as I can. I don't intend to jump into all of these things at once, but maybe, like one certification a year, or just do a few of these things starting out, and then gradually over time get all these different trainings. But I'm curious if there are any unique trainings that you guys have found, kind of like the perinatal mood disorders. It's not something you would necessarily think about as an add-on for midwifery, but something a little more unique that you guys have seen. Curious if you're seeing anything different out there. And then also, I am wondering if, how many people, is there anyone out there who's going to work in a facility where you don't have the option to do first assist for C-sections, or you don't have the option to do circumcisions? Like, is there anyone out there who is going to be maybe in a birth center where a lot of these things aren't done? Like, some birth centers will, refer patients even for colposcopies and IUDs and things like that. So I'm just curious if anyone's going to be in that type of setting where they don't really have the option to do all these things, even if they wanted to. And if you do, how are you going to go out of your way to further your education or your certifications, that sort of thing. Thanks for listening, guys.